Good morning and welcome to the 9:30 call. We are going to hear from the Early Childhood Agenda Workgroup 4 this morning. So we are recording it and it will be in the Early Childhood Agenda on the YouTube playlist. So Titus, I'll turn things right over to you and Jen. As you know, the first question is tell us a little bit about each of you, how you came to be in your current role, and we're excited for your update.
Thanks, Amy. Hello, everybody. Good morning. My name is Titus DosRemedios. I'm the Deputy Director at Strategies for Children and the liaison between Strategies for Children and the Early Childhood Agenda Workgroup number 4, focused on developmental screenings and referrals. And my co-presenter this morning is Jen DiCato. Jen, would you like to introduce yourself?
Sure, thank you. Hi, everyone. I'm Jen DiCato. So I'm with United Way of Mass Bay. I've been in my role for 5 years now as the program director of the Drive Initiative, which is one of our early education initiatives. For those who may not be familiar with Drive, Drive champions developmental screenings for children ages 0 to 6. We partner with early education programs, so that includes center-based, family childcare, home visiting, community agencies, state agencies, and so on. And prior to joining United Way, I worked directly with children, starting off as an elementary educator and then went on to pursue my master's degree in early childhood education, which led me to my next role as a clinical coordinator at an early intervention program in Boston for many years. And then I've had the pleasure of joining the Early Childhood Agenda Workgroup number 4 a couple months ago, as my colleague Carla Terrio was preparing for parental leave, and we just decided it would be a great fit for me to be able to plug into this work.
Thanks, Jen. And we have one of our work group lived experience leaders here, Laura McGowan. She can't really talk because she is with children at the time, doing good deeds there. But she will monitor the chat, and Laura has been a huge asset to our work group. Our work group also includes Corinne Kalbasa, our other lived experience leader. There's Laura in the chat. And Kate Barlow is our facilitator. Who also could not be here today, but has helped, all along and to prepare what we are about to talk to you about. So let's, Jen and I talked about giving a second intro with our own experience with screening and referrals. So that you can kind of hear how we come to this work. Our work group is focused on child development screening and referrals in early childhood. This is not something that I know much about at all. I work at Strategies for Children, and most of my, policy and practice knowledge is more around early, high quality early education and care programming and funding and policies for kind of the system as a whole. And I haven't really spent much time learning about or conducting screenings or referrals, particularly as we've learned in our work group about, the ASQ screener, early intervention, and how you, get screened for that and referred to that and transition from early intervention to public school. A lot of these topics were new to me, so I am thrilled to be able to help the work group and all the experts that we have on our work group try to make progress and keep the ball rolling, if you will, as we make progress towards some good policy recommendations for this issue. Jen, you have more experience than me, so why don't you share your story about how you came
Yeah.
to screening and referrals?
Absolutely. So, I think I've had, sort of been on two different sides of this, right? So my experience in early intervention, where I was receiving the referrals and working with families directly to promote, healthy child development. So that was, a really great experience to be able to have and take into the next role at United Way. And so, as I mentioned with Drive, we're really partnering with early ed programs to support them in the whole developmental screening process. So that's from training providers to, having that sort of ongoing technical assistance, and then really working on strategy and ways that they can be implementing a screening process, how it's going to work at each individual program. And, we've had a lot of what we've been able to do with our collaboration with Boston Opportunity Agenda and Boston Family Engagement Network in the Screen Every Child grant. We've been able to really focus in on sort of those gaps, right? So the last few years, we've been focusing in on access. So making sure that all children and families have access to developmental screenings. And then one of the things that we did find along the way is that, there's still a lot of work to be done in the whole referral and connecting families to referrals. And this is something we hear consistently with all of our partners, whether it be in Boston, and throughout Greater Boston and throughout our footprint, at least at United Way, but I know it's a statewide issue as well. And so, through Screen Every Child, we've been able to kind of figure out, what are the needs? Where do we need to really connect, make sure that families are connected, and that providers know, right, have a universal way of knowing what are the steps? How are we supposed to make these recommendations that are suitable for each child and family, and that's going to make sense for them? And then, one of the things that we did discover is that oftentimes we're not able to really find out, well, what is the follow through? Like, so if a family was recommended, if a provider recommended a referral to EI, there are definitely instances where they're not able to kind of close that loop on referrals and see, how is the family doing now? Have they received the services? Are they still waiting? And so there's definitely a real need there, and which is, a lot of the work that I think work group number 4 is focusing in on.
Thanks, Jen. So we have two short slides, well, three short slides technically, and then we're going to look at a survey because we're at the point in our work group's process where we're drafting and soon we'll be finalizing recommendations from our work group. Jen, are you able to share the slides?
I can, yes.
Okay.
Let me just get it. I'll put it in slideshow mode.
Okay, thanks.
Of course. All right.
Great. So you can see here our rather lengthy charge, right? This paragraph on the left was what is in the Early Childhood Agenda. The Early Childhood Agenda is 10 priorities for the early childhood system that many of you helped to vote on and approved back in fall of 2022 and were released at the State House January 2023. And the number 4 priority was this: ensure greater dissemination of publicly available tools related to developmental monitoring, universal screening, and is easily accessible to all children and families. Develop plans to increase system capacity to support evaluation, connection, referral, transition, and timely delivery of service. So the first thing we did, and you can go to the next slide, Jen, when our work group formed in September, this is the timeline of our history. We formed in September 2023, and we realized we need to narrow down that scope so that we can achieve something meaningful and concrete by the end of our time together. We only meet once a month, so we have limited time, but we decided to start with a survey, and that narrowed down our focus to, out of that whole paragraph, we were going to really just focus on improving the screening and referral process, and think of, processes, policies, connections, information, all relating to screening and referrals. That's what our work group told us were the most urgent needs. We spent most of our time promoting statewide screening week in the beginning of this year. So really from January to April, when statewide screening week was held. And there were more than 40 programs across the state that signed up as statewide screening week partners, and they hosted events to promote screening with families and with early childhood professionals that week in April. And we were able to actually give gift cards out to all of those host sites, thanks to the Early Childhood Agenda. So that was great. We created a poster and engaged the Early Childhood Agenda community and at Polar Park at our convening in May. And then since then, we have really been discussing gaps in the screening referral process. We heard from Pat Cameron from Family Ties, who also spoke on this 9:30 call a few weeks ago about the referral process and like different state resources. But we really wanted to drill down on like what are the gaps, like Jen said, even though we have systems, we fare pretty well as a state compared to other states in terms of like the percentage of children who are receiving early intervention. We know that there's improvement that can be made to close those loops and to get more information, training out to the field, supports to the field, and supports to families. So that's where we are now. We really are developing policy recommendations around that, around what we've learned, what our group is telling us. And then even though our work group is pretty small, we have about 5 to 10 regular members and maybe 40 people total who have attended a meeting, at least one meeting. The work group itself is small. So that's why we wanted to come to the 9:30 call to get feedback as we finish our policy recommendations, polish them up, and submit them by December. That's when all the early childhood agenda work groups will be submitting their final recommendations and kind of finalizing that process. So the next slide shows what we're looking at, and the survey that I'll show you in a minute is going to ask you these questions. And we're actually going to save, we're going to have about 5 minutes during this call right now for you to take the survey. But before you look at it, because the survey takes probably 2 minutes, I want to read the options on the survey so that you can know what they are before you take the survey. So we want you to tell us which of these recommendations you think we should prioritize in our work group. And you can see they're mostly legislative or regulatory reforms, but there is one research recommendation. Jen, would you let me read the top 3 and then you can read the next 3. Does that work?
Sounds good.
All right, so first one, expand statewide developmental screening and monitoring week with state government support. So that's the week that we had in April. It was the second annual monitoring week, but it's really just, a handful of volunteers who are making that week happen. So this recommendation would expand that week with state government support. Number 2 is create a common identifier to monitor children's progress from early intervention through the public school system. And we know there is some data alignment work happening by our state agencies, but this is really a priority of many in our work group. So what do you think? And number 3, conduct a research study of families and their experience with early intervention transition referral process. We have heard that we have very good data, but as a state, but we would like to learn more from families directly about their experiences so that we can just do a better job as a state of serving them. Okay, Jen, would you like to read the next 3?
Yes. So our next one is establish requirement for a 45-day follow-up on referral by any developmental screening referring agency. So again, that's really, connecting that closed loop referral to hear back from the referral source. Next, recommend steps toward the early relational health model that includes a closed loop referral and community screeners, as well as connections to state agencies. And last, recommend training and ongoing technical assistance required for providers that are conducting developmental monitoring and screening in a manner that invites and honors family voice and perspective. And then, of course, we have a spot here for folks to, if we've missed anything or you think of something that you can certainly put into the other box for us.
Okay, so if you want, Jen, you can leave that up if you'd like, that slide. I've put into the chat the survey link. So please click that link and we will take until 9:54 for you to take the survey. If you finish early, please put a comment in chat about your thoughts, about your experience with these issues, your personal stories, whatever you think will help us as a work group to make the best recommendations we can. And I already see a great story here from Edna about a family who got a call from the public school for a screening, and the parent was concerned, right? So, and thank you, Laura, for replying to Edna. So if you have any kind of question, comment, suggestion, after you take the survey, you can put it into the chat.
This is a big ask because I'm sure people would pick many different pieces. I think the other thing would be interesting to know if you know that other people are working on any of these pieces. So if you are part of an organization or you know somebody who's doing something around this, as we think about the early childhood agenda over the next 4 months, Strategies for Children is going to be engaging in a kind of a strategic plan refresh. And a big part of that is going to be thinking about the early childhood agenda. So I think one of the best parts of the agenda has been connecting with people who are doing this work who we hadn't been connected with before. And so especially something like this is not about like replicating or duplicating. It's really about strengthening and connecting. So that would probably be helpful information to share with Titus and Jen.
Thanks, Amy. Yes, like Jane Singer from the Brazelton Touchpoint Center, for example, is one of our partners, has attended our work group meetings, and even offered a free training in April. Really getting to what Edna was talking about, like the family perspective on this is so important for us to understand, empathize with, because it is, it can be scary, it can be very confusing, and all of these early screening tools are designed to really like prevent and support children as early as possible. And anyway, Jane Singer's team at Brazelton has a fantastic tool about development being a journey, and a training that goes along with that to help early childhood professionals explain the results of screenings to families. This is one of the things that we think there needs to be more of in our state, like more trainings, more support, because it's one thing to conduct this as just a process. It's another thing to really have the skills to explain the results and support families, coach families through the process, and then follow up, like Jen was saying, follow up to find out how did it go. If you were referred to a service, did you get it? Was it helpful? All of those things need to happen, right? Ideally. Okay, one more minute. Please finish your survey. I'll share my screen. Oh, Jen, if you could take down your screen, I will share my screen just to show folks the survey here. Right, so this is what we were just doing. This is our work group leaders, Kate, Carla, Laura, Corinne, Jen, and myself, and these were the questions. We're not going to show the results now. We have gotten about 20 results prior to today. So we were really hoping that with today's 9:30 call, we could boost those results. You can share the link with other people in your networks if you know folks who are really passionate about this issue or who are curious about this issue. I'm also going to put in the link for those of you in the Early Childhood Agenda Basecamp already. You can catch up on all of our work groups, meetings, videos, notes, slides are all saved in our Basecamp. But for now, so we have a few minutes left. Jen, do you have any questions for our 9:30 callers about screenings and referrals, or about the recommendations? What should we get in these precious few final minutes?
I know. I'm trying to think. I don't know that I have any questions that come to mind. I mean, certainly if it's useful for folks to ask us anything while we have this time together. Um, I mean, I appreciate it. I see these numbers like increasing by the second. So thank you all so much for your help on this. It's really appreciated.
Did anyone put other in their survey and want to talk about what they put in the survey? We're not just limited to the 6 ideas we read out loud. If you have a good idea, we may include it. We may combine recommendations. We're still in that phase of getting all the good ideas, and then we'll finalize them in the months ahead. So did someone put an other?
Kim Davenport has her
Go
hand
ahead,
up.
Kim.
Kim?
Hi. I did put a couple of others, ideas. One that I just wanted to raise to see if it came up in your work group was the ease of which providers, family childcare, center-based, the professionals that are working with children every day, can be connected into this process, including, from screening to potential referrals to evaluation and ongoing support. It just seems to be very difficult to make that happen, and more blockages are there and than I think maybe needed. And those providers are so close to families and naturally have the relationships and can help, but it's very difficult to get permissioning, and it's every step you've got another form to fill out, and then no, it has to be from this place, and it has to be from that one. And all the providers are trying to do is support the families to get to their appointments or to make that screening time reasonable, and not, find out 10 hours or, overnight that you have to be somewhere the next morning. And there has to be a better way to loop in the providers into this process to support families.
Absolutely. I agree with that. And I will say, I think that that's why having the professional development, right, in those more of those training opportunities, because, it's not necessarily just knowing how to administer a developmental screening. It's really the heart of the work is the discussion with families. So what is the purpose? Why are they being asked to complete a screening? But also, how are we sharing the results where it's going to, continue to work on that relationship, right, with a caregiver and a provider to keep, that trust there, but also work as a team, right? And so a lot of those training opportunities really build on those skills. So I appreciate you bringing that up.
I agree. I also think there's a systems integration piece that could be strengthened, because as soon as you go outside of like some community supports and you start dealing with districts, it becomes much more complicated to be part of the team. And that's, development is a journey, and I added ... and we're here to help, or we're on your team, or like that's what it really needs to feel for families. And instead it's a little rocky, to say it nicely.
Thanks, Kim. Any other comments? I saw a good chat from a couple of good chats from other people. Linda and Kathleen. Yes, Kathleen, we are trying to align recommendations so across the work groups. So possibly like a common identifier or data recommendations would be like into that category. Good point.
Yeah, there's a lot about IDs.
Yeah, I was a few minutes late. I'm sorry for the question. It was more of a clarifying question. When you're talking about a common identifier, are you talking about like a student, like in the schools, we have a student information system that tracks, from the moment they come in to kindergarten, but like, is there a system that would track prior to that?
That's what we all, I think, many in the early childhood field would want, right? We know there is a SACID ID that a child gets when they enroll in public school. there's never really been an equivalent of that in the birth to 5 world. And it makes it, and services like screenings and referrals to early intervention add like different programming, different touch points, and different opportunities for like aligning around a common ID. So I think that's what we've been talking about. Yep.
And are there a list of recommended like screeners and assessments that are put out, like here's what you should use across the board, or is it sorry, or are there recommendations? So, and I'm coming from the public school setting, so we have assessments and we collect data, and the state says you need to collect data, but it won't say like you have to use,
Right.
Dibbles or iReady or STAR assessment or whatever. It's just, so is there something like that in the birth to 5 world?
I was
Amy-
laughing because like that's
Amy
the
could probably-
$1 million question at 9:59. There's been, I think, and Marissa added in chat, there have been like this discussion has been going on for a long time. And I think that's why it was the 4th most popular agenda item, right? So that's why it's number 4, work group 4 on the early childhood agenda. Jen, what would you, I would say there's no consensus around.
Yeah, there's really not. I mean, I think in in certain parts of this state, especially in like for in healthcare, they're using SWIC, right? And then I think EEC really supports ages and stages questionnaire. So I think, I mean, to me, a developmental screening is, thinking of it as like, that's sort of like your first step is a screening. And then from there to continue to like monitor a child, you would use an assessment. And then, and I think that's one of the things as in the training is to really break down the difference between developmental screening, assessment, evaluation, because I think that's valuable for not only for families to know the difference, but for providers too, to be able to know, okay, this is how I can use this, and this is how I can continue to monitor a child's development. But as far as if there's one better than the other, that's really hard to say. I know ages and stages well because that's what we in the Drive initiative we train our partners on. And what I like about it is that it does really encourage the parents and family engagement and being, kind of the first teacher and the expert on their child. So that's why we really like that one. But it's not to say that others are not as, useful and beneficial.
Well, and here we are at 10:02. What a great discussion, great feedback, good structure of the call, the survey. And I think there's always an opportunity to join the work group. So Titus, maybe in the last minute, you could put the Early Childhood Agenda website in the chat. So if you're interested, as Titus said, the work groups are meeting once a month. We have a October date scheduled for the full Early Childhood Agenda convening, and we'll share more information on the 9:30 call. But let's first thank Jen and Titus for joining us and giving us the opportunity to weigh in, and for this great discussion, everyone who contributed. We'll save the chat. I'll send it to Jen and Titus so we have it. And then Titus and Jen, if you could just send the slides, we'll post it in the follow-up folder.
Thank you so much.
And
Thanks,
then
Amy.
tomorrow, we are excited to have the 9:30 call at night in Spanish at 9:30 in the morning. So please join us. The call will be in Spanish and translated into English. And we'll hear from folks from Urban College and all the work that they're doing. So thanks for joining us, and we'll see you tomorrow.